Hey, Facebook. Coming to you as the sunset is staring me in the face, hence my washed out white face. Maybe it'll change in the course of the video, but I am sitting in yet another grocery store parking lot on my way home from Hartford. But while it was still light outside, wanted to stop and say hello and catch you up on a few things. My hearings are done for the day, but as we speak, there's several important hearings going on, but one of them is in the Insurance and Real Estate Committee, which is having a hearing on two bills that I've spoken about before. One is Senate Bill 346, which basically would create a public option for Connecticut. It's a hard, complicated bill. And so there are a lot of people who are testifying about that as we speak, and I imagine it will go through some changes, but I'll keep you abreast of that because I know a lot of you have been interested in that. And the other is SB 328, and as always, I'll put this stuff in the newsletter tomorrow, which contains several of the some initiatives that we looked at last year. One is allowing for importation of prescription drugs from Canada. Another one involves reinsurance and helping to, lower insurance costs that way. And also a benchmarking option that the governor has made a priority in his budget this year that would, it's essentially an option, a plan that would, it's modeled off a plan in Massachusetts, and it will measure healthcare costs and track costs, and Massachusetts has been able to save about $5 billion annually on that. So that's an important bill as well. I also want to thank you. I posted tomorrow, there are a lot of environmental bills that are getting a hearing, and I heard from so many of you when I posted that. And so thank you all for your advocacy, and for those of you who may be here tomorrow to testify for them, and or submit your testimony. I've gotten lots of written testimony of various kinds. Anything counts. So thank you for that. It was nice to hear from so many people. So the first thing I want to touch on is coronavirus. We are getting continual updates, and again, so tomorrow morning there will be a public forum involving all the relevant parts of the state government with the latest information on the state's response and the status of that. So that all the details from that will be in tomorrow's newsletter. But in the meantime, I just wanted to pass along a couple things. First of all, some of you may have seen there was an article somewhere suggesting that rural hospitals sometimes are at the end of supply chains, and so rural hospitals across the country, some of them are not getting the adequate amount of supplies. So I have spoken with Dr. Mark Herco, who's the new head of Sharon Hospital, and some people at Nuvance, which is the partnership that Sharon is part of, who have given me a lot of information about the preparedness, and in fact that they have been through sort of dress rehearsals for how they would deal with an infection, and they sound pretty ready. And I, of course, have offered to be, made sure that we're all in connection, so that if there's anything they need in terms of advocacy at the state level, I'm happy to do that. But I was impressed by their level of knowledge, and of course, because Nuvance is in both New York State and Connecticut, it's getting resources from both. Another thing, we've been discussing the budgetary impact of that in an appropriations subcommittee that deals with this, but Connecticut was waiting to see what the federal government would do, and you may have read yesterday, I believe, the federal government approved a package of over $8 billion for Corona or COVID-19, and that, as part of that package, states will get at least $4 million each. So we're not sure exactly how much will be available for Connecticut, but at least $4 million, and again, I'll give you updates on that tomorrow. Just a couple of quick things, because people have been asking, should you go to your doctor or emergency department if you think you have corona? The answer is no, not immediately. You should first call your own physician or the Department of Public Health and tell them what you're experiencing, because they have a very specific set of a protocol to go through with you, and they'll ask you about travel and other relevant risk factors. So that's just to make sure that the resources are being spent appropriately. There are some travel advisories. They are related to travel from countries that are level 3: China, Iran, Italy, and South Korea. And other countries that are level 2, which includes Japan. Special protocols for that. I'll put that in tomorrow's newsletter. But again, if you have had any travel to or from those places, you should check the CDC website for the latest information. And the other stuff I've said before, but it's a lot of us, if you've had little kids, you've been through this, or I have both, my mom was in spent her last years at a nursing home with dementia, and we're familiar with what happens when there's a lockdown for an infection or when you have little kids and there's some sort of virus moving through, which is wash your hands, sing happy birthday twice while you're washing your hands, no more shaking hands, use your elbow, or the knuckle dap is a new one. Just try to do common sense things that can help, limit the spread of any infectious disease. So those are all healthy things to do. So again, more details tomorrow after the forum. And nothing I wanted to bring to attention that I'll put in there is about weatherization, changing topics here. Just a reminder, it is still wintertime, and a lot of people end up having high energy bills and don't have adequate heat in their homes because of inadequate weatherization of their homes. And Eversource is offering another service to audit that, which I'll give information on, so that they've brought the cost down to $75. So I think that'll help some people. I wanted to highlight a couple of, in addition to the environmental bills, which I highlighted, and I'll put again in the newsletter, but I put in the Facebook post the other day, or an e-blast, actually, sorry. I guess it's not on Facebook. I should put it on Facebook. Sorry, Facebook. There's a couple things in Judiciary. So we had a press conference on I think what will be the one gun safety bill in Judiciary, certainly that I will be advocating for, and it relates to risk warrants. And Connecticut already has a risk warrant statute, which essentially allows someone who is at risk of causing harm to themselves or others, the police, law enforcement is able to go in and make that assessment and then remove a weapon from a household in those circumstances. It has some limitations because, among other things, if you have someone, and I just heard this story from someone at an event recently, whose daughter, sadly, she lost her daughter to a suicide by gun, and her daughter had been, depressed and having suicidal thoughts off and on for years. Any medical professionals, the family, if they had been able to obtain a risk warrant they didn't want to go to the police because that felt too intrusive, but this bill would allow them to go to the court and make an application based on the safety of this person or others in the household, and have a weapon removed, a gun removed from the household if it was deemed that this person was a threat to themselves or others. It would allow members of the family, again, to approach courts to do that. It would also be a little bit more proactive, and in this case, this woman was telling me that, if it was a question, she bought the weapon while she was undergoing this mental crisis. And if there had been something in place that could have prevented her from purchasing a weapon when she was under that, in that situation, she could be alive and with us today. So I think that's an important bill, details to be fleshed out. That is HB 5448. Again, I'll put that information out tomorrow. And then another bill, there are actually two versions of this that I've mentioned before, is a clean slate bill. And the governor has put forward a proposal for certain misdemeanors. If once somebody has served their sentence and any other probationary term, if they commit no further offenses, for 7 years, they can have their records expunged so that they, will have adequate access to jobs and housing and not be encumbered by this record for the rest and effectively receive a life sentence for what was, a minor offense and something that they have recovered from. So those are bills. There are two versions of those, and they will have a public hearing on Monday, the 9th. So I'll give information about that in the newsletter as well. Just to highlight a few recent events, I went to a part of a great conference this weekend. This is NCSL, which is the bipartisan national conference of state legislatures. Held a conference for fiscal leaders in New York this weekend, so it was easy to get to, and I could stay with friends. And sadly, I missed the first day because I had hearings and votes, and so I couldn't get there until Friday evening. But I did spend all Saturday there, and I spent some time with a couple of the head of our Office of Fiscal Analysis and the chair of our Finance Committee, so that's always good time spent. But also presentations on rural economic development, including broadband, so good information there. Some economic trend update. Of course, that was somewhat dominated by the fact that the market volatility relating a lot to Corona. Connecticut actually got some props for its although our unfunded liabilities are serious, they did cause us to put in place some pretty serious fiscal constraints and also stress testing of our budget, and that sort of measurement is we got a lot of credit for being honest about our liabilities and addressing them in a sustainable way going forward. Still lots to do, but it's a good start. Also, a presentation from an epidemiologist, interestingly, on evidence-informed policymaking. And we were all, this being fiscal leaders, we were all sort of laughing about the fact that somebody would have to convince anyone that evidence-influenced policy was something that we need to do, because that seems sort of obvious, but we are where we are. But this the presenter gave a lot of information about how to look at various things that claim to be evidence, and what are more high quality sources of evidence and what are a little bit more questionable, and how to find that. And that's very helpful when you're facing a lot of emotional issues where there are people making claims on both sides and also twisting data to make various points. And so that was a really timely and helpful presentation that I enjoyed. I also want to thank a lot of you came out. I had a forum at Noble Horizons 2 nights ago, earlier this week. It's always nice to be at Noble. That is where my mom spent the last years of her life. She was struggling with dementia, sadly, but she was given love and care by many people there, and made a lot of friends in the community. And so it's always nice to be at that space again. But thank you all who came out for that. We had a great conversation about a whole range of issues, and that was fun. I went to dinner for the annual meeting of the Northwest Connecticut YMCA the other night. Also a great event. So many great people who are dedicated to improving the lives of all people. It's called the Y now. Just it's shorthand, but it's not even just for young people. It helps an awful lot of people, and there was a lot of moving testimony about it, what it does, its commitment to caring for people in the community. So that was a nice event too. Tomorrow, there's a lot going on. I've already outlined the environment hearing. We have a Judiciary hearing as well. I'm also going to try to make it to Torrington to be with Senator Murphy for an event on prescription drugs at McCall. That will involve a lot of mileage in my car as I go to Hartford in the morning, to Torrington, back to Hartford. But, we'll see if I can do that. I'll highlight some of the bills that are on for tomorrow, but I think I've put that in other communication earlier this week. It's also International Women and Girls Day. It's International Women's Day this Sunday, and it's International Women and Girls Day, the version of that, the workaday version at the Capitol tomorrow. And so we are suggested to wear purple, so I'll find something purple to wear. But we will have a lot of high school girls from across the state joining us for various events in the day, which is always fun. So I'm looking forward to that. And one other upcoming event that I wanted to flag, and again, more information in the newsletter, but on March 19th, there's going to be a CareerCon 2020, which the governor has putting together. It's the Connecticut's largest career and occupational expo at Dunkin' Donuts Park in Hartford. So it sounds really interesting. It's not a job fair. It's an opportunity to learn about all kinds of careers that don't require 4 years of college, but give people tools and skills they need to earn a living. So it sounds really interesting and valuable. So again, I'll post information about that. And I am going to stop and get myself some groceries, and then I'm going to go home and do a lot of reading for tomorrow. But I'm going to make a confession to you about the first thing I'm going to read, which is this stack of beautiful thank you notes from Mrs. Palladino's 5th grade class. I've mentioned that before, but I've saved this beautiful stack mostly because I didn't want to take this lovely ribbon off. But tonight I'm going to read these, maybe to my husband and my son. So thank you for these lovely thank you notes. There is tremendous value in a beautiful hand-done thank you note. Okay, so more information in the newsletter. It will be packed. So have a great weekend. Talk to you soon.